everyone, this is Mrs. Markle going to take a few minutes to review some information specific to home care and case management for week 6 community content. So when looking at the roles of community health nurses, especially we're going to focus on home health, but community health nurses can practice in diverse settings, and this can include as like a public health nurse, home health nurse, hospice, occupational health, school nurses. Those are just a couple examples of what roles of nurses may be within community health specifically. But when we're looking here at the different roles, there's many, and the home health nurse is going to function as multiple things: educator, providing nursing interventions, coordinating the care, and as the nurse going into the home of the client, they also need to be good with critical thinking skills. This is going to be essential, and also be able to prioritize what needs to be done within each visit. When patients transition back to the home, things may still be at a critical point. Family members may need extra education. Family members may need extra help, extra services to be able to care properly for their loved one with specific disease processes, or ensuring that they do what they can so they don't end up back in the hospital right away. I'm just going to let you read the next 2 slides. These are just lists of specific practice settings within the community that you may see nurses that is deemed community health. So when nurses within the community are providing care for clients within the home, they're providing care where the the client resides. And this could end up being within the home, or it could be, say, the individual resides in like an assisted living facility or a nursing home. So home health nurses could go into those facilities as well to provide extra services. Home health care, there may be an extra push for it. There are increased costs associated to healthcare services within institutional settings. Family takes on a lot of the care, but then that could place a strain on the family, and issues that are affecting the patient could end up affecting their overall self-esteem, their mental wellness. We do have an increasingly aging population, and people like to age in place. So things to think about when going into wherever the client is residing: we want to know safety. We want to help preserve the individual's dignity, and we want to support their independence as possible to maintain their safety. When going into the home, nurses do need to make sure that they are ensuring their own safety, but noting that they are a guest in the client's home. So you want to make sure that you're respecting values of the client and whomever may be within the house. Looking at the combination with aging population, patients are living with increased chronic disease. There's a higher prevalence of chronic disease within America. So goals may slightly transition to trying to improve quality of life. We want to early identify if the patient starts having exacerbations of their disease, so we can intervene early to try to deter them from having to quickly go into the hospital. We want to catch things early, try to treat in the home, and prevent those hospital readmissions. And as the last bullet point there is the importance of aging in place. And this, people like to stay where they're comfortable. They like to stay where they're, within the home, and stay around individuals whom they love. And quality health care in places where they are going to live most of their lives, and trying to bring the services to them. Some additional services that you might find within the home. Previously we talked about the adults or older adults especially with living with chronic health illnesses, or maybe they just came from the hospital, so now it's an acute thing. So we want to ensure symptom management, prevent exacerbation of disease, continuity of care, so we're doing those check-ins, those follow-ups. Maybe it's not safe for the patient to go into the home, or go back into the hospital or to an office for a check-in, so we're gonna, or maybe there's limited resources to get them there, so in order to ensure the continuity of the follow-up, we're gonna go to them. Older adults, this could then transition to more like hospice palliative care. And when looking at hospice specifically, trying to enhance quality of life through palliative care, supporting the patient and their family or whoever their support or their loved ones may be. This could be during end of life, supporting them through like with bereavement support as well. Hospice can be provided in a variety of settings. This is going to be more comprehensive care. Patients who are terminally ill may be those receiving hospice care. And the focus for the patient, there's a transition more of how do we help relieve pain, how do we make them comfortable, and how do we enhance overall quality of life. Other things could be maybe they need therapy, maybe they have heart failure, they have living with like liver disease, kidney disease, lung disease, COPD, something like that, or diabetes even, and we're helping them with symptom management. We want to support the patient with dignity, and then when working with families or loved ones, we may need to consider respite care because of the risk of caregiver burden. And caregiver burnout, just due to all of the weight of the caregiving services being placed on family, maybe a couple family members, or even just one caregiver within the home of the client. Respite care is going to be specifically for the loved ones who are caregiving, and it will allow them time to focus on themselves, take some time out of the day to leave the house, leave wherever they are, to give them a break. And kind of do a little self-care for themselves. Home health services could also be gauged towards moms and newborns, so this could be like well checks, growth checks, or if there's any concerns related to feeding, or if the new mom and family, new parents, if they need additional resources, that can also be connected with them when looking at like the outpatient center versus the home. Or children and parents, like children with developmental concerns or children living with complex medical concerns. And then therapy could also come into the home. That could include physical, occupational, and speech. As people age, requirements or resources that they're going to need for their care become more long-term, and it increases. This care can be expensive, and many may start to feel the financial burden that's associated with ensuring appropriate care for their loved ones. So when looking to pay for long-term care, this could include utilizing a couple things such as personal finances and funds, or some government insurance programs such as Medicare, Medicaid could also assist, and there are some life insurance policies as well that could be utilized. But all of that is going to require somebody to help. If the patient doesn't already have these services, they're going to need somebody to help them obtain the services or even start the process for seeing if they're eligible. We already talked about this. I'm just highlighting when looking at qualifying criteria for like Medicare. Patient must be homebound. They must be under the care of a physician. They're in need of skilled intermittent care. Medicaid, the requirements could depend on state, and they could also help them sign up for like a Medicare waiver, but there are specific eligibility criteria. But home health services can be reimbursed by local, state, and federal funds. The respite care piece, Medicare will cover most costs up to about 5 days within a hospital or skilled nursing facility setting for clients when they're receiving hospice care. A lot of the one-on-one care or like respite care within the home may end up turning to like private pay. So there can be this financial burden on the family, their caregivers, and there's already enough going on for them, and this is just one additional piece. So in order to ensure that your client is receiving the best care possible and all of their needs are being met, you do need to ensure that interdisciplinary care and communication. When looking at interdisciplinary care with professional communication, this can be a priority for the patient. We're maintaining the patient and their family at the center of their care, and it helps with the shared decision making between client and family. Can be collaborative to provide optimal patient care, and it helps to understand the goals that the patient and the care may have for their care specifically. So over here on the left are just examples of individuals that could be part of that collaborative process. And as the nurse within community health, especially within the home and with home care, you have a role of helping to maintain continuity of care for your client. And this, when thinking about who you can partner with, these are some individuals. You also want to ensure that you are partnering with the family and the patient and their family, respecting the autonomy and the right to make a decision by the patient, and you are listening to what their goals are for their time with you. We mentioned some of these, but there are qualities of home healthcare nurses that are especially important when going individually, or you're going into the home by yourselves. You need to be knowledgeable and skilled in your practice. You need to understand the priorities of the disease process that the patient is living with. You need to be able to make some decisions independently and know when to reach out and be collaborative. You want to remain accountable, you're going to advocate, you coordinate your services, and then you provide that education for the patient and family. When initiating a home visit, it's important for the nurse to understand what are the patient's goals. You have your own goals, but you want to have positive outcomes for your interactions, so you need to ensure that the patient's goals are understood. You want to know who is living with the patient, what are their roles, what are their responsibilities. When we evaluate the patient's home environment, safety is going to be a large piece for both yourself and the patient. And you want to understand, does the patient have access to appropriate resources? And that could be, for like their ADLs, food, basic needs, mobility devices for them to be safe within the home, transportation to get them to their appointments, and even like home utilities to ensure that they have proper heat, water, and electricity, especially, and like Wi-Fi if needed for telehealth follow-ups. So safety is of great priority and concern when performing a home visit. So assessing your patient's environment and the risk of falls, and what you can do to prevent falls. So when assessing the home, when looking for safety, you want to pay close attention to what's around you. So are there rugs that are non-secure? What do the electric outlets look like? Is there the presence of like extension cords going along the floor Does the patient use oxygen? Are they doing things in the home that they shouldn't be with oxygen? Like, are they smoking? Are there like portable heaters? What kind of lighting do they have? Is it appropriate and safe for them to move around? Is there clutter? Are there animals? What kind of hazards are there? Do they have safety devices within the bathroom or for ambulating as well? Our older adults are have a very high risk for falls, especially with those other sensory deficits that can occur with age. So you want to think as well when looking about basic factors access to services. We want to ask, does the client have food in the house? Do they have access to nutritious food specific to their chronic disease? Who helps them with their chores and their household activities? Who helps them clean up? Who helps them cook meals? Do they live alone? What about their medications? Can they take their medications safely by themselves? Do they need someone to help organize them weekly? Do they have a good system to know when to take them and what to take? And do they have access to health care? So do they have access specifically to like a primary health care provider who would be knowledgeable of like the needs of our geriatric patient population? And do they have when thinking about like transportation to get to the offices and their visits, what does that look like for them? And you could think like emergency procedures too, like do they have smoke detectors that are working? Do they have like emergency care service numbers, so they know what to do if a fire were to break out? And I'd also want to know like what is their what is their vision? What are they able to smell? And their hearing. Do they have any impairment to their hearing as well? In case, if something's burning on the stove, can they smell it? Do they know what to do quickly? Or do they have neuropathy in their extremities? If they go to wash the dishes or get a bath, can they sense appropriately if that water is too hot, and putting them at risk for potential burns? There is a great risk for med errors, specifically with our older adults, and if there's multiple number of chronic comorbidities. So risk for polypharmacy too, if they have multiple concerns and they have multiple providers and things aren't being reconciled. If you think about negative side effects of meds, risk of dehydration, risk of falls due to like orthostatic hypotension, changes to vision, changes to like level of consciousness if they're taking too much of medication for like anxiety, or even if you have decreased perfusion from low heart rate, low blood pressure, that can cause risk for altered level of consciousness. Or if they need to pee more, are they going to be able to get to the bathroom quick enough? If they're getting frustrated with what the meds are for, are they going to continue them? Are they going to hold them? What are they doing? So you want to understand and kind of do the teach back, sit with them, and ensure that they know how to correctly administer the meds. Are they storing their meds safely? Do they have pets? Are there kids that could get into their meds? Or do they have opioid medications, pain medications, and like are people, do they know about these meds? Are they getting in to get the meds? So there can be a high risk for med errors. So when we look at client education, we want to provide education with the patient because it does help to encourage client independence and support them caring for themselves, and then it also can allow the families or the support person to be involved and support that shared decision making. So you want to consider a couple things. You want to make sure that if the patient starts to present with like drug-induced cognitive changes or behavioral changes, they're not being treated with additional drugs, like why, what's happening, what's going on? Are they hypoxic? Do they have a UTI? What's their blood pressure? What's their overall perfusion? You don't want to disregard new presenting symptoms. take your time, work with them to do a med reconciliation, and help them understand via demonstration, teach-back method. Remember the things we talked about specifically to teaching learning with health education. And know like age-appropriate written education, but know like what's their reading level like, what's their overall level of health literacy, and you want to be attentive that they understand. If they don't, you do want to encourage that the family is involved, or if they're not, that they get involved. You can help bridge that gap, or it helps to advocate for more frequent visits, or maybe it's not safe for them to be in the home anymore by themselves. So you want to remain attentive to those needs. There are advantages and disadvantages to home visits. Advantages gives you a better picture of the client and the situation that's going on. It helps you to recognize if there's social needs, if there's health needs that are kind of starting to present themselves. You can understand like what's the relationship between the patient and their family. Are they safely able to perform their EDLs, and what influence of either resources or lack of resources, or even the environment that they're living in, what does that have on their health? Disadvantage, cost, and when thinking about like HIPAA within the home environment, you want to think, how can I be sensitive to that? Making sure that like your computer, your electronic devices are not turned on, they're closed, they're turned down. If you're talking to a patient, are you in a private area if they don't want anybody to hear? Another thing you want to be cognizant of is presence of like neglect or abuse, especially with our older adults. Aging.pa.gov is a great resource for especially older adult resources, and things to look for, specific to physical abuse. Do you see the presence of bruising, broken bones, or do they kind of like guard themselves when you go to touch certain areas of their body? Financial abuse, there's a high risk for older adults. They can get wrapped up in scams, they can get wrapped up in being nice and trusting people, or people just take advantage of them. Sexual abuse, risk in the older adults, or neglect. Family members or the caregivers are neglecting the basic needs of the client. So if you do notice signs of abuse, you are mandated to report. You do need to report that. You need to follow your facility's protocol for reporting. You need to notify your leadership or whoever your management is, and then you also need to be very detailed with your charting and your documentation. You need to be sensitive to the needs of the client, but definitely make sure that you are reporting. Case management. So this is a care coordinator case management. It's going to be a collaborative process, and there can be improvement, when you're looking at incorporating case management. It can help to meet the needs of your client and through quality and cost-effective services. Case management is indicated for multiple settings within healthcare. It's a collaborative process, so you're kind of going to be the link to maintaining the relationships between like the client, family members, resources, healthcare professionals, meeting the needs of the client. Case management can help to decrease costs by early notification or awareness of issues that are present. This can help to optimize and improve client outcomes, can help to reduce gaps and errors in care. You want to ensure that the discharge planning, if you're helping with the times of transition, inpatient to outpatient, and then keeping them in the community and keeping them where they want to be, if they are safely able to be. Discharge starts at the time of admission, And this also requires ongoing communication and is an essential component of your continuity of care for your client, anticipates future needs for your client. As a case manager, you do need to make sure that you are a thorough communicator. You can facilitate therapeutic communication. You can facilitate effective communication. And you're able to identify and advocate for the needs of your client to multiple parties that are involved. You help to ensure that the patient is being billed right. You help to ensure that the resources are being allocated appropriately. You help to coordinate among providers, therapy. You be proactive for the client. You're aware and knowledgeable of what the patient is dealing with. And you look at what's available within the community or surrounding or near the client so you can utilize things appropriately. If they need referrals, then you, in order to meet the needs of their medical diagnosis, then the case manager or care coordinator will also work on referrals between healthcare services, specialty care services, and understand if there are barriers present. So general functions of case managers, you need to be able to assess. So you assess health needs, you help to educate, you're empowering the client to make an informed decision. We're helping times of transition. We promote autonomy and self-advocacy for the client to help them know when to ask questions and when to question things. Might be activities, could be disease specific, especially for things that have a high risk of hospital readmission. So heart failure is a big one, kidney disease, diabetes, COPD, think about all those big chronic health conditions. Can be team approached, especially if a client has complex health needs and you're going to manage quality with cost-effective interventions. In addition to linking to the resources, you help them navigate the healthcare system. And then looking at the communication with other entities, like if the family's not hearing back from the doctor, or referrals were placed and we haven't, no one's reached out in a little while, they can help to work on that as well. You can take a moment and just read through this as kind of a synopsis of what we just talked about. And those are some resources. So when we're in class together, we will highlight a few key points from this recording, and we will also take some time to review aggregates and aggregate care. So then you have what you need moving forward as you work towards the final exam and the end of the course.